snow. No, it's not ice, but it's snow because we are at the top of a mountain. And
And I was just testing the water.
leaving Boston this morning, we weren't really thinking that we were going to be
In the snow again.
in the snow again. But here we are. Oh boy, this should be interesting. In front of us is Mom and Piero. And there's this cute guy driving the car that you can't see. Tulips in the back. So car sick, by the way. Poor little pooper. She's like miserable.
Actually, no, let me just go down the street.
But we're here almost 24 hours after we left Rhode Island. More pictures to come. Every single thing here is gluten-free. Like, look at the selection of everything gluten-free. This is crazy. Look at, oh my goodness, everything. Welcome to Italy. Hi everybody, I'm going for a walk. I wanted to say hi. I really miss everybody, and of course haven't been able to put up a video in the last couple of weeks because of the move, but this is my attempt to show you where I am right now. So if you follow me on Instagram, you know that I am in a little town, hamlet I would call it. It looks like a place where you'd see a hamlet, right? Called Bobbiano, which is closest to another place called Travo, which is near Piacenza, which is in Emilia-Romagna, which is of course in Italy. And it's beautiful, of course. The sun is out today, which is really nice. There's a little bit of snow that's melting. It's amazing. I have so much to update you on. First thing I want to tell you about was that where we left off was me with my hip issues. And some of you, again, who follow me on Instagram saw my Instagram stories where I kind of was very tearful one day talking about, you know, potential diagnosis. So the day after that, I had an MRI. The doctor, I'm very lucky, who gave me the, who had to do the needle because it was the MRI with contrast, he was very, very sweet, very kind to me. The needle did not feel good. But I think I'm just particularly sensitive, being honest. So he was very kind. They did the MRI. So the same person who kind of got me nervous about the MRI called me to give me the results of that, which was like a labral tear and a athletic or sports hernia, tendinopathy in the hamstrings, all this stuff. And she said, you know, this is going to be bad or whatever. But the fact is that when I went to see the actual orthopedic surgeon, he is amazing, by the way, and Dr. Tabador. If anyone is in the Rhode Island area and needs to, an athlete who needs to see an orthopedic surgeon, especially a runner, he is an athlete himself. He's amazing. He explained to me that that diagnosis isn't quite the way he would describe what's going on in there. I definitely have a labral tear. I have something called pelvic, well, it's called pubalgia, which is a fancy word for kind of something that looks like a tear at the base of the rectus abdominis. The rest of it kind of doesn't matter, according to this doctor. He does not recommend surgery, and he really feels like I can get quite a bit of relief just by going ahead and doing a ton of PT. He set me up with a great PT, physical therapist, that I had the opportunity to see twice before I left Rhode Island. She was amazing. She explained a lot of things to me and set me up with some exercises that I took video of, and I'm going to use while I'm here. So, where am I right now? I've done quite a bit of work with the foam roller because my legs are so tight that I can't even like squat or do anything basically. And a lot of work with the foam roller, a lot of work doing strengthening exercises, which by the way, I have no strength in my outer glutes. That's what the main problem is. Also, my lower abdominals, despite all the yoga I do, are super weak. And when it comes down to it, I am where I am because of those weaknesses. So the objective right now is to go through the PT, continue to do all of the foam rolling, do that PT, try to get the strength up in those areas. And this doctor really feels like I'll be able to make a really awesome recovery. And that I'll be able to do a lot of stuff without pain. Now, here's something very interesting. I'm gonna switch hands, so hang on. Gosh, my arms are weak. Come on, I can't even hold the camera. Okay, so something very interesting is that over the course of the last couple of weeks, because I was kind of going through the move, I could not do any yoga at all. And I noticed that on the plane ride here, I mean, six hours to Paris and then, you know, an hour and a half on the plane to Milan, my hips didn't bother me, right? And I haven't done yoga in a couple of weeks. And then I did yoga a couple of days ago, and guess what? Pain kind of came back. So what I am going to do is kind of not do yoga right now, just to kind of give myself a chance to see if I can get some relief and feel better. I think that's the smartest thing to do, so I'm going to stick with the PT stuff and the foam rolling and the walking. And as you can see, there's tons of hills here, so I'm going to be getting some good butt strengthening just by doing that. And that's the update so far. I'm saying this with a smile because I know you saw me super teary on Instagram, and I'm happy to report that that is not going to be where I stay. I'm going to put a smile back on this face. Oh, by the way, this is the name of my house, Caserote, because here we are in a place where there's no numbers. And so people know where you live by the name of your house. Yeah. So I am going to, of course, show you more around where I live and tell you about more fun stuff and update you on everything and get back in the swing of weekly videos. Thank you guys for being patient. And also, I have to get on emails, you guys. I'm so sorry. I am absolutely, I have so many emails to answer, so I am aware. But I love you all, and I will see you soon. Bye.